iron can catalyze and help to cause oxidation of low-density lipoproteins within the atherosclerotic plaque. So it's sufficient to say that iron overload and iron excess can drive the process of cardiovascular disease, of cardiovascular dysfunction and the coronary artery occlusion and the narrowing of the arteries. So we have a tool, my friends, that is very affordable, that has been clinically studied, that has been shown in diabetic patients and also in patients with cardiovascular disease to reduce the prevalence of those conditions. So some of the things we'll also talk about today is fatty liver disease and how fatty liver disease can actually be reversed by just donating blood. There's a paper actually, we're going to talk about it. I'll just give you a little hint at what it's called here. Iron depletion by phlebotomy improves insulin resistance in patients with non-alcoholic fatty liver disease. We know fatty liver disease, unfortunately, is so common. It's not just from eating dietary fat, okay? We know that insulin and hyperinsulinemia causes changes in iron metabolism, iron absorption, and all aspects of iron physiology and ferritin metabolism. So this paper found that in individuals who have a histologically defined non-alcoholic fatty liver disease, that just donating blood over the course of several weeks dramatically improved their blood sugar handling. But I want you to ask, when was the last time a doctor told you or someone you know who has insulin resistance, obesity, fatty liver disease to donate blood? They say, no, you need to take this drug, take this medication, we'll see you in 6 weeks. But you never hear about donating blood. But this is so important because it turns out that iron overload, excessive iron, we'll talk about how you can quantify this looking at your labs, gets stored in the liver, gets stored in the pancreas, gets stored in the heart, and it can even impact the brain. So we have a simple modality. I just donated blood yesterday. You might be able to see this little prick. I don't know if that comes through on the camera, but I donated blood yesterday. I'm on the sort of my cadence is every 6 months because I'm one of these males that tends to have a higher hemoglobin, hematocrit, and ferritin. But hemoglobin, hematocrit, and ferritin are things that should be on your radar. Again, if you're a male of any age, or especially if you're a postmenopausal or perimenopausal woman, because it turns out that after menopause, women naturally sort of bloodlet, when they're menstruating. And when that stops, they can accumulate iron. Senescent red blood cells. Red blood cells are at the end of their lifespan. When they die, this is how your body gets iron. And so it's just this turnover. And that process is impacted by hormones, by insulin, by glucose, and things like that. So it's not just dietary heme iron that is part of the problem. This is a natural process that happens in the body when your red blood cells are broken down. About 90% of your daily iron needs, do all the oxygen transportation and so forth. Part of that iron, your needs come from the breakdown. A huge part of that comes from the breakdown of red blood cells.
DoctorsToTrust.com, the world's #1 site for short, annotated nutrition videos.